Hitting a record high number of cases all across the United States, and Washington, D.C. is seeing numbers spike all over again this week. D.C. Mayor Bowser reinstated an indoor mask mandate and will also require a proof of vaccination at some places indoors starting on January 15th. So joining us now is state epidemiologist of the D.C. Department of Health, Dr. Anil Mangla. Dr. Mangla, welcome to CAPA Review, and thank you so much for being here. So we know this has been the big talker of the week. So what have COVID rates been like in Washington, D.C. that's been so alarming to bring an indoor mask mandate back and to require proof of vaccination?
Yes, thank you for that. So in DC, our case rates have skyrocketed by ninefold compared to a month ago, which was just about after Thanksgiving. So right now, our daily case rate a month ago was 15 cases per 100,000 population. At the moment, it is now hitting 141 daily case rates per 100,000 population.
And for those who are unvaccinated and watching this right now, can you tell us about the effectiveness of the vaccine and also of the booster for people who already got the vaccine and considering whether or not they should go out and get the booster?
Yes, so the booster is very important. And the booster, I'm going to kind of go into step-by-step protocols on why the booster is important, even if you are vaccinated. So individuals that are fully vaccinated are 10 times less likely to get infected if they already have a booster, right? This is compared to individuals that are not vaccinated. Also, if you get your booster, you are 2.5% less likely to get infected compared to individuals that are fully vaccinated. So think of it, fully vaccinated and you get a booster, your chances of being infected is 2.5 times less likely. Also, the important thing here compared to unvaccinated individuals, if you have a booster, you're 20 times less likely of dying from COVID than anybody that's not vaccinated. So this is important. And the reason behind all this is once you get that third dose or the booster, what happens in your immune system is your antibodies increase by 25 to 37-fold. That means this is your body's protection, right? And this protection is going to help. So if you get COVID, you have enough antibodies to actually react and neutralize the virus within your system. So this is very important when it comes to boosters and also being fully vaccinated. If you're eligible for your booster, get your booster.
Yeah, thank you so much for clarifying that, because I think you really explained a lot just right there. And testing, of course, is so important right now. What are the best ways to actually go and get tested? Should people do a rapid test, a PCR test, or an at-home test? What would you advise?
Yes, so these are very important. And now that we have readily available rapid tests, there are certain circumstances where you use it. So if you have symptoms, get tested. You could do a rapid test and you could do a PCR test. The advantage of this rapid test is it's going to give you results within that 15 to 30 minutes. It's at home, you get it done, compared to a PCR that's sent to a laboratory, takes about 3 to 5 days to get that test back. If you do not have symptoms, you could still do that rapid test. You could also do a PCR, so that is important. The other thing is if you assume you're going to a show or you're going out somewhere, why not just get tested? Because if you get tested, you're positive, you don't want to be out in the community, right? So again, these rapid tests are very important for the state-of-the-art immediate results that you can get right at home.
And what are the similarities and differences in the symptoms between COVID-19, the Delta variant, and Omicron variant? Because everyone's feeling something nowadays during this season.
Yeah, so this is a great question. There is not enough substantial evidence on data of what the difference is. But according to previous data that has been shown very clearly that this disease has milder symptoms. And so the symptoms people are seeing are very clear. The 5 common symptoms, number 1 is fatigue. Number 2 is your headache. Number 3, sore throat. You're also going to have a runny nose. And then finally, sneezing. So this is very common to a common cold. And that's why if you have these rapid tests, get tested. Because if you're symptomatic with some of these and you do a rapid test, these rapid tests are really specific in identifying that you may be positive.
All right, we're taking a closer look at the Omicron variant and what this means for your holiday plans with Dr. Mangla when we come back. You're watching Capitol Review.